For anyone I haven't met, my name is Annette Marcus, and I use she, her pronouns, and I work as the policy manager for the Oregon Alliance to Prevent Suicide. And I just want to, before we start the meeting today, I briefly want to acknowledge the fact that Gallie Murray, who you'll be hearing more from, has been the chair for 2 consecutive terms, which means that for the last 4 years, she has been ably providing leadership for us, and we're really grateful for that. And I'm also really grateful that she has assured us that she will continue to engage with the suicide prevention work that we all are doing together, and is very committed to ongoing work. We're very fortunate that we have Charlotte Lemby, who is going to be stepping into that chair position starting in September. And this is a meeting today where we're going to be talking about some ways that things may need to shift and move forward, and want to just kind of set a framework for us using the chat today in a way that we think will be effective, and really ask that we use the chat to, you can put questions in the chat, like if you have questions either for questions for the speaker, but let's please not use the chat for kind of ongoing comments and that kind of thing, because I think we really need to hear everybody's perspective in a thoughtful way, and it's very hard for folks to track both what's happening in the chat and what's happening verbally. So if folks are okay with that, I think with that, I will pass this on to Gallie, who will kind of guide us through the meeting today.
Okay, folks. And Annette, your audio is still kind of coming and going. So we heard most of what you said, but we got the vibe, but it is a little bit coming in and out. So just FYI. All right, folks. Good morning once again. My name is Gallie Murray. I use she, her pronouns. I am serving as your chair right now. But as Annette said, I'll be passing that baton here shortly. We are going to be meeting today. We normally meet until 12:30 for our quarterly meetings. We are meeting until 11 today, so giving you the gift of time on this Friday. The second part of our meeting today, we are hoping to hear from our OHA colleagues around the latest statewide data regarding youth suicide. However, first, before we hear that, we're going to hear from OHA leadership, from Chelsea Holcomb. And as many of you know, that over the past couple of months, Oregon Health Authority has received a lot of guidance from the Department of Justice in Oregon, or known as DOJ, regarding bringing Oregon Health Authority's statutorily enacted advisory groups into better compliance with public meeting law. The Oregon Alliance to Prevent Suicide is one of these groups. These changes that Chelsea and other OHA folks are going to talk about today will impact the way that we do our work, and both members and affiliates, and how we all work together. I know with 100% confidence that Alliance staff, our OHA colleagues, are all absolutely committed, and all of you are all committed to moving the work forward of suicide prevention in the state of Oregon. I will also add that personally, I'm absolutely committed to making sure that this work moves forward, and that the voices of lived experience and equity are centered around how we do this work and how we engage our community and cross-sector involvement. Chelsea Holcomb, who is the director of Child and Family Behavioral Health at OHA, that's a mouthful, is going to provide an overview, probably lots of information for you all, an overview of the laws that will impact this group, and a little bit about our current situation. I will say, just personally, folks, there's a lot of information. as someone who's been involved in these conversations, it's been really hard to track. It's been really hard to understand. There's a lot of complexities. And I know that our OHA team is also experiencing a lot of this is hard to track. This is really complex. So I'm hoping that with Chelsea's conversation with us, that if folks have questions or thoughts, like this is a time, this is not the only time, but this is a time to be able to ask questions, share what you're thinking while we have our OHA colleagues in the room. Again, this is not the only time, but this is a great time to do that. And we may or may not get to our data presentation at the end of the meeting, and that is okay, because this conversation takes precedence over anything else. So with that, I'm going to turn it over to Chelsea to do a lot of listening. Chelsea, it is all yours.
Thank you. Can you take the slides down? Unless you need this slide. Do we need the slides?
I don't think so.
No. Okay.
I'll pull them up
It sounded
again
like
when
more
we
of us.
get, I'll pull them up when we need membership to look at, but until then, no.
Thank you. Thank you. Sorry. I don't know. Sometimes slide decks freak me out and get me more nervous, and then I forget what I'm actually supposed to say. Just my own thing. So hi, everyone. I know so many of you, so thank you for having me. Again, I oversee child and family behavioral health work at the Oregon Health Authority and been in my position about 6.5 years, and get the pleasure of working with all of you and Jill Baker and Shanda on my team. And then we work in close partnership with public health to support the youth suicide prevention, intervention, and postvention work. So Gally did a great job, but I also just want to name that, again, Gally, you've been involved in this work a really long time, and just acknowledging and also celebrating your 4 years as the role that you've played has been magnificent and amazing, and really grounding. I don't know if I find you very grounding as a human, of being able to, like, even when chaos ensues and even the complexity of all the conversations that we've had over the last few months, like, I still find you grounding, and your ability to even hold space for emotion and passion and complexity, but then still ask really good pointed questions. So I just wanted to name that skill. There's lots of other things I could say, but I know you've been doing this work a long time, which should be celebrated, in addition to just 4 years of the chair, but just really appreciate the work that you've done with this group. So thank you.
Thank you.
And I
Thank you.
and I don't know Charlotte as well, but I'm looking forward to working with you and excited to get to know you better, and certainly offer any support that OHA can support as you and Don take the reins, and create different shoes, not fill previous shoes. Yeah, okay, I just had to start there because you guys are also amazing and this work is so important. So as Gally said, I think, so you are not alone. We at OHA have realized that as we have set up committees, commissions, work groups, we love these in Oregon, and Oregon Health Authority actually has quite a few. And our legislature also likes these committees, which is good because it really makes and formalizes bringing community together to tackle hard issues in Oregon. When this group was established was actually before my time, but it happened to bring together a group of folks through efforts from the legislature to really target and support youth suicide efforts in Oregon. And so this group was brought together by one of my previous staff, Ann Kirkwood, and she also amazing human. But at that time, to be honest, and I'm just being super transparent, there was not the level of understanding, technical assistance and support either from DOJ or the health authority to stand up committees. It's a little different when it's a governor appointed committee because there's much more structure when their governor is appointing members to a committee or a commission. But when it's OHA led, it has evolved over the years that I've been here. Oh, thank you, Gally. I was thinking like a document, like because you already said it, that I could then say it. So I was like in document mode.
I'm with you, but I
Um,
was like, who knows? So I just
Fair.
put it in there anyways.
It's fair. Hold me accountable. It's good. So I guess from that background, knowing that we all do the best we can with what we have, and so this group was stood up and then became more formalized with the passage of a bill to make sure that this group was in statute. And the difference there is that we can create committees all the time if we want to at Oregon Health Authority. It doesn't have to be in statute. It doesn't have to be mandated. But having it in statute is nice because that means like if I left my job and suddenly someone else came in and was like, nah, we don't need the alliance, like we're good. We wanted to make sure that, right, that Oregon Health Authority is mandated to have this group. So this group existed prior and then was formalized in statute when that bill passed. And all that to say is that there's different definitions of these groups, but there's core pieces of the responsibility of these groups as you are sort of volunteering on behalf of and for the Oregon Health Authority. Some of those structures we did not have in place for the Alliance. And so what we've realized through our consultation and education and learning over the last 3 to 6 months is that we need to make sure that we give you all the resources and structure and scaffolding to come in line with the statute authority that you have and also public meeting law. So I'm going to slow down a little bit and make sure I'm not going too fast because all that is, like Gally says, it's a lot of information that I want to make sure I'm communicating well and in an organized way. But if anyone has questions so far, you can either put in the chat or raise your hand. Otherwise,
Chelsea, can I
Please.
add one thing that helps my brain understand that I think I was confused about until pretty recently, is that I thought that it was different, that pre-707 was different than and 707 is the legislation that was passed that put the Oregon Alliance into statute, that OHA has to have this body and has to have this committee. I thought it wasn't a committee of OHA for some reason. Like in my mind, it was like it didn't exist before, and then 707 passed, and then it did exist. And that's not true. That this has been a committee of OHA since its inception in 2016. And we should have, knowing that we didn't know, and you just work with the information that you have, that we should have been following the public meeting law pieces as a committee of OHA from that start, and we weren't. And that is probably more OHA's fault than anyone else's. So not casting blame, casting blame where it belongs to be cast, I guess. Although let's not cast blame.
Let's not cast blame, but we take ownership of that because it's our job as the hosting agency to support all of you to do great work. It's our responsibility to help and give you the right information to do the work you're doing. And so that is what we are doing now. But yes, thank you, Jill. That's really helpful. So the two buckets, and again, I'm bucketing it because it works for my brain. But again, Jill and Gally and others, feel free to, if I miss anything or need to be more clear. The two areas that we are looking to support you all in getting into that alignment is the first one is the public meetings law. And this again applies to all of our committees. And there are a few elements of the public meeting law. Most of them, again, the Alliance has been following for many years. There's a couple there that we need to make sure that we update the bylaws and the practice of the Alliance to make sure we come into compliance with that law, because it is law. It's not a suggestion. It's actually in statute, which means we have to follow it. And then the other piece is the statute authority. And so when the Alliance went into statute, there are specific pieces of the responsibility of the Alliance to do, and that is the group's statute authority, meaning that is the authority you have as it relates to your relationship with the Oregon Health Authority. So those are the two buckets in my mind that we are looking to all of you and to partner with you moving forward to bring your bylaws into alignment with public meeting law and help Annette and others to sort of put that into practice. And then the other piece is the statute authority and making sure that the bylaws themselves, but also the actions and the work of the alliance is within that statute authority. Jill?
Laura Rose has a couple questions, sounds like.
Hi, Laura Rose.
Hi, is this an okay time?
Absolutely.
Okay, I'm also, wrapping my head around things and learning more about public meeting law and learning more about even where ODOJ is in terms of the executive branch and all of that. One of
Mhm.
my questions is, so the Oregon Department of Justice has a number of divisions. What division is working on this compliance piece? Do we know that? Like, for example, there's the Office of the Attorney General, and then there's a couple of, other pieces. And does any of this intersect with like a Secretary of State audit in the works or something like that?
Mm,
I wasn't
good
sure what was kind of driving the recent push on the compliance, and
The
so,
compliant.
yeah.
Yeah, great questions. Shannon O'Fallon is the identified attorney within Department of Justice for OHA. I don't know which division she's in of DOJ. So we can find that out for sure. But she's our main attorney. We work with lots of attorneys, but she's our appointed attorney for the
Right, OHA.
organization.
Okay, all right. And is there
Um,
any understanding of sort of what was the kickoff driver for that piece?
Yeah, good question. There's no I hope there isn't one coming. There's no Secretary of State audit coming. This literally came from not just this committee, but other committees within OHA of other complexities have come up within different committees, including like our Oregon Consumer Activities, or no, the OCAC, Oregon
Yeah, Oregon Consumer Advisory
Yeah.
Council.
Advisory Council, thank you. And CSAC, which is the Children's System Advisory Council, and even SOCAC, which is the System of Care. Those are the ones I'm aware of, System of Care Advisory Council, that have run into questions about quorum, questions about the different areas of public meeting law. And so it's happening actually across behavioral health. And so in conversations with DOJ, we had sent the bylaws of the Alliance for review and feedback. And that's what prompted some of the more targeted back and forth around the Alliance, if that makes sense.
That does. Thank you very much.
Any other questions? I think Laura Rose, your hand went back up. Do you have another question?
Well, sort of, just maybe sort of a comment. I don't know if we'll have time to talk about it much today, but I think some of the things that I hear from, because I do belong to different councils, advisory councils and whatnot, sometimes it's like getting two different answers to the same question, if you will, in terms of how things are supposed to operate. And I guess one of my concerns would be that the requested changes are sort of considered about their consistency and their feasibility. For example, on the Oregon Consumer Advisory Council, we did really important work for the state. I believe there were so many times of, researching best practices and putting things that go into the recommendations and things like that. Sometimes there have been misunderstandings of the interpretations about like the role, and right now OCAC happens to be going through rulemaking on this very subject, but
Yeah.
I guess that was just triggered my other question, was like, has the Alliance the version that's in statute, is that in realms of public meeting law considered a governing body? And then also, like, we want to make sure that the work can get done so that it's feasible. But sometimes what we hear is things like that you're not allowed to communicate with each other. There was like a boundary if, the idea is that you're not making decisions outside of the meeting because it's so important for the public to be involved, aware, accessible, all that. But there is work that has to be done, and you can't meet every day, or you're trying to
Right.
meet subject matter experts and talk over things that are part of like work that you bring back to the committee so you can do those votes and things like that. But whether that kind of thing falls into this line of you can't talk to each other, and then of course many of us have multiple relationships, not just state advising, but we might be in other spheres. So that's the feasibility, I think, is the big question for me after just the smaller question of, are we for sure a governing body? Because there's a interesting paragraph about that in the Attorney General's Public Meeting Law Handbook or manual.
Yeah, thank you. And I think it goes to what Callie was saying, is that some of this is, we have to work with our, with DOJ and with OHA leadership on interpretation and expectations, right? Because we want to, like, sometimes the language is like, if you're going to be doing the work on behalf of the committee or making decisions or recommendations to make a decision of the committee, that needs to happen in sort of that public meeting space. But what does that mean, right? Like if Gallery's having a conversation, with, I'm trying to think of, with Don about stuff within the committee, what is that threshold? And I think that's where the bylaws can be really helpful, of trying to either give more guidance and or examples. Again, I'm in other committees as well, Laura, where this is happening in those committees. And like, okay, well, if we're going to do this particular work, including updating bylaws, right? Like when we do that work, who does it? How do they do it? And what does that look like with public meeting law? Because they're doing work on behalf of the committee, right? If you update your bylaws, but they're not voting on it, they're not making decisions, but they are doing the work of, and that does have to be part of that public meeting law. So I agree with you, but I think that's where I think I hope to partner with all of you, brilliant humans, of trying to figure out how do we structure it so that it maximizes how the work gets done within the structure, the scaffolding of the law. Does that make sense? Oh, it's good to see your face. I mean, I love your picture too, but it's good to see your face. So the other piece that, I mean, Laura Rose brings up a good point, is part of the public meeting law does mean that it's public, right? Like people need to have access to and be able to witness the beautiful and amazing conversations and work that you all are doing. And they need to be notified of it, and the work and things cannot happen behind the scenes. The other piece around the statute authority, which is the other piece that I think we've had some conversations about, is that because the group is advising OHA on all things suicide prevention, that is the statutory authority. You all are working with us to move that work forward. There has been work that has happened in the past where folks on the Alliance have actually, had, and the language was, and this is again on us, that we didn't realize sort of how the nuance of this, right, is that you all need to be advising us on a legislative agenda around youth suicide and prevention intervention versus having your own and operating independently or outside of OHA. One of the weird, interesting complexities of working at a government agency is that I myself, while I do lots of education for the legislature and the governor's office and internal to OHA, and especially during legislative session, we actually become, I mean, it's a weird word to say, but sort of a neutral body, right? Where we are educating the lawmakers as they make decisions and have conversations. So when I'm presenting at the legislature, it's on behalf of Oregon Health Authority, and it's in an informational capacity, but not an advocacy capacity. I don't know if that makes sense. So I guess I want to pause there, because it took me and some of my team members as we come into government a minute to think about those two things. So we're like informational, we're educating, we're talking about pros and cons, potential, intended or unintended consequences of decisions that lawmakers are making, but we aren't advocating or writing the legislation unless asked, of course. Sometimes they ask us to help. Mary?
I'm just trying to wrap my head around this. You said work on your, you don't work on your own versus, I can't remember the second part of that. Are you talking about you HOA employees or are you talking about Alliance members?
Well, in this case, because you're working on behalf of the Oregon Health Authority, sort of the committee itself needs to be making recommendations to the Oregon Health Authority and talking about those things too. It's not that you can't talk about it outside of, but to actually go lobby or, write legislation or testify, it would need to be clear, and this is true for me as well. It would need to be clear that you are testifying on behalf of yourself, or maybe even the organization you work for, if that's okay with your organization. And for example, for me, I would have to take a day off or not be working. And then when testifying, let's say I wanted to testify on behalf of, Clean Air Act or something like that, I would have to name that I am, testifying on behalf of myself as an individual in Oregon and not in my role as the Oregon Health Authority. So those are the examples I was trying to get. So being able to sit down with a legislator, for example, and really, work out language for a bill or advocate for a bill, that is a separation that we have not in the past had with the Alliance to Prevent Suicide. That has been a grayer area where people and the Alliance itself has acted as a advocacy body,
So
not
Mary,
just to OHA. Yeah.
Mary, just to drill down on what Chelsea's saying too. So the Alliance would need to say to Oregon Health Authority, here's what our priorities are. And we would give those to Oregon Health Authority. And then Oregon Health Authority would determine what of those, all, none, some, are going to be included in their own advocacy policy agenda. But
Yeah.
we are the Senate Bill 707 as statutorily required group is not able to, like Chelsea's saying, testify, develop a policy agenda, all of those things. It has to be, we would advise Oregon Health
Or the
Authority on that.
agency.
I want to call, there's two questions / remarks in the chat. One, Gordon is saying, it sounds like this is, I'm going to flip this around to be a question. Can we lobby for a program? We can only inform and not lobby. For Gordon, will you ask your question so I make sure I'm getting it correct? If you're able to, I don't know if are you there?
I'm here.
Oh, good. Will you ask your
yeah.
question so we can make sure to get it right?
Yeah, and this has been a concern, is that it has felt like we have lobbied on the state floor and in our advocacy for our programs. And my understanding of public meeting law is that's not something we can do. We can inform, we can give them the ideas and the concepts, but we can't sell it, So,
Right.
and it's that lobby piece, I think,
Yeah.
and the wording and the use of the word lobby, that we have to be very clear that we are not doing that. That's my understanding.
I think that's accurate, Gordon. And I see Laura's, you had your hand up and it's gone, and Sandy, I see your hand. I'm just looking at stuff in the chat just because I want to make sure that that we're talking about everything here. Angela wrote, I serve as the chair of the Oregon chapter of the American Foundation for Suicide Prevention, or AFSP, and organize our state Capitol Day, working on and advocating for legislation as an AFSP volunteer. would this prevent me from doing work with the Alliance and AFSP?
This is a great question because I think this has come up. So, and Jill answered it in the chat, and you absolutely can do both. And if you're lobbying and doing those other activities, you just need to be really clear what hat you have on. And I think of it as hat. I work a lot with Dr. Ajit Jetmalani, who has multiple hats. And so sometimes when he's at the legislature presenting, or if he goes to a committee, sometimes his hat is as the director of psychiatry at OHSU, and sometimes he wouldn't be up there as his hat with OHA consultant. So it's just being really clear. And again, you guys, again, this is a very known body, so I think this is complex, but if you state it, especially if you're presenting, it's public record as you state what hat you have on. I'll give one more example, and then Sandy and Laura. We have members of the System of Care Advisory Council, for example, which is another council I work closely with, and they have members that also advocate on behalf of their organizations. So they work at hospitals or they work at OHSU. I gave that example. And when they have come to testify on behalf of or in support of bills, they name that they are doing that on behalf of their organization and not on behalf of System of Care Advisory Council. So those are ways that it is happening, that both of those things are happening at the same time. We just need to be really clear when we're in those spaces, who you are representing. And the other piece about that that's really important is that you may have a strong opinion or be advocating for something that the full alliance or the full committee isn't necessarily in full support of. And so that's the other piece of that, is that we want to make sure that if you are representing the alliance in the spaces you are, that this full body has voted on that or agreed as a body that that's something to move forward.
And then the
Sandy?
follow-up question, Sandy, thanks for your
Okay.
patience. Angela's asking, I appreciate the detail, Angela, that you're asking. So in the past, we have put the Alliance logo on the American Foundation for Suicide Prevention State Capitol Day papers. Is that something that can still happen?
Let me follow up on that particular question, because I think this is where it goes to what some of the ask is today, is that we really need to dive into and love on, and it's not everybody's favorite thing to do, the bylaws for this group, because I think those are things that we can get more nuanced about in the bylaws so that scaffolding is super clear for those questions. But I don't know the quick answer to that, so I don't want to guess.
So we'll put that in the parking lot for follow-up.
Yeah, great
And
question.
thank you for, I know Linda is here taking amazing notes as she always does, so I appreciate
Oh, good.
that.
Thank you.
Sandy, thanks for your patience. Go for it.
That's okay, thank you. I think there's another nuance in this conversation that I'm hoping that I correctly understand. The Alliance and OHA already have a relationship, and that seems to be a fairly responsive and good working relationship. And at the same time, moving the structure to be really clear about what the Alliance can do and what we need to rely on OHA for, or what OHA needs to rely on the Alliance for, can make that working relationship stronger. And I think an example of that from years past, like way a long time ago, Laura Rose probably remembers some of this, is that if the Alliance were to go to OHA and say, these are priorities we'd like to ask OHA to have around policy option packages, for example, that OHA would come back to us with their list of policy option packages, and we would see that there's a direct response, either in favor or not, and there would be some explanation about why or why not. And, I think the positive thing about that is that we're doing work together, which is really,
Right.
The ideal.
That's the goal.
Right.
Yeah. Well, first of all, it's lovely to see your face. I have not seen you for a long time, so I'm glad to see you.
Thank you.
But absolutely. I mean, I think that's, although the governor creates that process, and it was very different this last go around POP. So I think that's another place where we can you know, look at bylaws to solidify that relationship, because I think Gally brought up a good point when we were talking a couple months ago of like, it may be a good collaborative into, you know, relationship, and that sometimes is person dependent, right? And you know, I think we want to make sure that this group, regardless of who's chair, regardless of who is in my position or Jill's position, that there is enough supportive scaffolding, that there are clear expectations on those relationships. And that includes the relationship with AOCMHP, because not most committees are just, they are staffed by OHA staff. And so it's a more direct relationship. And the beautiful, you know, complexity of this is that it's really a trifecta between us and our contracted support staff, Annette and others on the AOCMHP and OHA. So really working collaboratively. But I love what you're saying of just being really clear what those roles are and what the expectations are back and forth.
Can I add one more thing? I'm sorry. I it just, as you were talking.
No, Sandy, don't apologize.
Kelsey.
Yeah.
This is the
I
time.
think-
This is the time to do it. So
Yeah,
ask
I
away.
think the one
Ask
thing in
away.
the back of my mind that I would definitely be concerned about on any commission or council or whatever is then where are we at if the council or the OHA were not in agreement about some pretty important initiatives, especially when it relates to legislation or budgets or that kind of thing. And I know that the Alliance does not, you know, set the budgets or anything like that. But I think, you know, it just leaves a question mark in the back of my mind in terms of how do we work through those kinds of things, and maybe setting up some kind of structure or agreement around how like major disagreements would be handled. So that's another one that I think would be important.
I'm hearing Sandy wanting to work on bylaws is what I'm hearing. I'm just naming that for you.
I think also,
Jill,
folks,
you have your hand. Oh, go ahead.
Sandy, you're bringing up questions. So again, questions that we don't have the answers to today, whether OHA doesn't have them or we don't have them collectively, they're going on, you know, Jill has a list, Linda has a list for us. So there's lots of questions that, you know, we will find the answers to. Jill had her hand up, and then I see Stephanie, and then Annette has a question in the chat. So folks, I would urge you, if you have a question, let's raise your hand in here in this room, because also the stuff in the chat, I want to make sure it gets translated into the minutes. So we have record of these questions. So raise your hand if you have questions, so we can hear your voice and get your question answered, or at least put it in the parking lot. Jill Baker, go for it.
I just wanted to name, Sandy, you mentioned the volley, the working relationship that we've had about the Alliance recommends funding pieces or priorities to me. I chew on it, come back and say, here's what does work and doesn't work, did align and didn't align, and that is well within, like, that doesn't change in this iteration, that what Chelsea's talking about is directly going to legislators or that type of thing to say, here's what we're advocating for on behalf of the Alliance, that you as a human, you as an AFSP volunteer, you as a member of a different advocacy organization can still do all of those things. That one of the things that I lay awake at night around this conversation is that one of the reasons that Oregon has such a strong suicide prevention team and infrastructure is that ability to say, okay, people who you are the champions of suicide prevention all around our state. What do you think? And then how does that translate into government land? And then going that back and forth is so precious. And that's and that doesn't, at least from my vantage point, that doesn't change with this. That's exactly what needs to happen.
And honestly, what Jill just described is the purpose of having advisory council. So, I mean, I wish that happened in all of them, but I would second what Jill said. Sandy, did you still have a question, or is that a residue hand? Okay.
Stephanie, go for it. Stephanie, Stephanie, are you there?
Yep.
Oh, there you are.
Hi.
Hi.
I got
Go
the
for it.
video and I forgot the mute. We just had a meeting with our work group, workforce committee, and Annette so lovingly kind of prepared us for this meeting. I guess I have a few questions, concerns, and so we have all these amazing committees that do a lot of work behind the scenes. And to me, that is what makes this alliance actually tick and get things done. Like Jill was saying, like we have an amazing group of humans who work on our individual passions and committees, and will those monthly committees go away? Because my very brief understanding of this is that we're not necessarily allowed to meet outside unless it's the whole entire voting member group. Unless we're all meeting, do we have to wait until our quarterly meetings? That's my first question.
Great question. And none of those subcommittees need to go away, but they do need to follow public meeting law. And so if you're making a decision on behalf of, I'll give you some examples. So if you're making a decision on behalf of the whole alliance, which it doesn't sound like happens in your work groups, but if you were voting something for the whole alliance, you would have to have the authority to do it, and it would have to be public. If you're doing work on behalf of the alliance, which it sounds like you're talking about, that needs to follow public meeting law, which means others need to be able to know that that meeting is happening. It needs to be posted, and other people need to be able to join. And again, if there was a decision that was being made, I'm trying to think of an example, like you're gonna make a decision of what to bring back to the larger alliance to vote on, right? Let's say you're picking evidence-based curriculum for suicide prevention, and that was the work group, and you're gonna, decide on 7 to move back to the full alliance to vote on. I'm making stuff up. Jill will have better examples. But if you do that on behalf of the alliance, then that needs to be public meeting law. And if you were going to do any kind of formal decision or vote, then that requires quorum. And that's the quorum question is like the complexity. I know System of Care Advisory Council is working on that too. But absolutely subgroups can happen. I think SOCAC has 7 that they do. Again, they follow public meeting law, they're public, they have people, members and non-members of SOCAC doing work, and then filtering any decisions or any votes back up to the larger committee.
I'm gonna bring it back to one question that I heard you ask, Stephanie, is what happens between meetings? So my understanding based on public meeting law, and again, I'm learning a lot through this process, as I know a lot of us are, is that Stephanie asked the question, like, if Stephanie and I are on a committee together and we're working on, say, I'm going to make it real because things that we've all done, we're working on a paper or concept paper that this group has done several times, that have been, very influential papers, recommendations, right? And Stephanie and I are maybe, leading that in this group, but maybe Stephanie and I want to work on it individually. My understanding is that we cannot do that. Is that correct? Outside of the committee that has been posted for public meeting law.
My understanding, and I'll look to Jill too, is that you can't make decisions. You can't make decisions. So work can happen. But if you and Stephanie were doing the work and the paper outside of public, writing obviously can happen, right? Or coordination. But if you were making decisions or I'm trying to think of a good example with a paper, because you have to write a paper outside of.
So they were
committee that
writing a
would take
paper
forever.
and Stephanie's working on one section and I'm working on another. And maybe Stephanie and I are the responsible party for putting all the sections together and to make it have one voice. My understanding based on conversations with DOJ is that work, I remember her saying, and I see Annette's writing, work cannot happen outside of meetings.
Yeah, I would want to take that back, because I already know that that happens in other committees, like what you're talking about, because you have to bring something back to your subcommittee to then have the finished product to then bring back to the larger committee. But the public meeting law, again, it's like, but if you and Stephanie just did like 6 months of work outside of the committee on behalf of the committee, and nobody in Oregon knew that that was happening or had access to participate and things like that, I think that's what it's, so I would take that question back with that example, because I think that's what DOJ has been looking for, is like, what are concrete examples so that we can tease the what's okay, what's not okay, given the spirit of the law. Because again, the spirit of the law is making sure that you all aren't doing stuff on behalf of or without other members. But if you were going to bring that back to a public meeting space and say, hey, we got our sections organized and the voice congruent, here's subcommittee, we did our homework. Now are we ready to vote that this goes back to the larger alliance? I feel like that would meet that need. But again, I'm not an attorney and don't play one on TV.
So can we, because sorry,
sorry.
just to put a pin just for a second, and Stephanie, I'll come back to you just so I know, can we put on OHA's list and AOCMHP's list that we need clear, direct from the mouth of DOJ in writing advice about that? Because
I think if we can give a couple of more examples, Gally, that would be helpful. It sounds like you guys have lots of it. If there's been lots of work happening outside of public meeting law, if you guys could give us 4 or 5 examples of that, then I think that would help get the nuance clear.
okay,
So
so
we can
I
help
have
define what
perfect-
work means.
I have a
Annette-
perfect one.
yeah,
Yeah,
Stephanie, go ahead.
Our workforce committee is working right now on deciding whether we put forth legislation on mandating continuing education requirements for medical providers for suicide prevention. And we have been interviewing people all throughout the state, medical providers, and trying to get information behind the scenes to try and understand how to best succeed in putting this legislation forth and or doing it different. And so again, this is meeting beyond our committee, coming back to our committee, and then do we not, now it sounds like we don't meet with legislators and put this forth that we've been working on since 2016. So it's
Well, there's two pieces there. One, it's a great example of sort of work outside of a committee. So I think that's a good example we can put on our list for DOJ. Like, can the committee go do interviews with, providers or other folks as part of their homework of the committee work? So I think that's a great example of that question as it relates to public meeting law. The second part of what you said goes into this other piece around what your statute authority is under the Alliance to Prevent Suicide. And you don't have that legislative authority to do that piece. And that's the big, well, a couple big shifts here, right? But that's a big one, right? Where the Alliance itself, as the committee for on behalf of OHA, you can still do that work and then recommend to Jill, right, to OHA, that you would like the Oregon Health Authority to put forth that legislation as a legislative concept. That's our avenue to put forth, and we do those all the time. So we put forth our legislative concepts or our POPs. People are talking about policy option packages is how we ask for money. Sometimes they're combined. And so it from the Alliance to us, it would be, here's what we recommend. Here's language we recommend. Here's timing we recommend. You could put all of it in there. It's the going directly to a legislator and saying, hi, Senator person, like, on behalf of the Alliance, we would like you to do this legislation. individuals within the Alliance, organizations you all work for, the other advocacy organization that was mentioned earlier, all can do that work. You just can't do it on behalf of or with the hat on as the Alliance to Prevent Suicide, as the committee for OHA.
And that's not a small, like,
Not a small.
not a small thing. Like that is, that's one of the, aside from of how, like I can see on faces like frustration tolerance waning a bit about the public meeting. Can we do this? Can we do that? Like, aside from all of that, the direct writing of legislation and advocating for legislation as an OHA advisory committee, that's one of the like
We
cornerstones.
don't have the authority to do that. So other commissions have authority to do that. So a different definition, a governor appointed commission of those groups do have that ability. So the System of Care Advisory Council that I mentioned before, they have different statute authority to do things like that, which is bring forth, advocate for, and lobby on behalf of. And I'm sure that's not the exact language. But this committee, as it's written in statute, does not have that statutory authority currently in statute.
So I'm going to pivot. Annette, you have a question in the chat. Would you be able to? I'm happy to read it. This is Annette's question, and then Annette, you go ahead. Ask your question.
Can you hear me okay?
You're muffled, but try again.
I
There.
just, you know what? I think it was answered actually by Chelsea saying we cannot introduce legislation.
Okay. So I just want to also say that I apologize, this isn't fair, but not all of you were allowed to see this document because of attorney-client privilege based on what OHA had said. But there is a document that I have in front of me that is our current bylaws that DOJ and Oregon Health Authority kind of went through and redlined. And I think I'm feeling confused because in this document, there is very clear guidance from DOJ about some things that are different than I'm hearing today. So I think rather than getting in the weeds, like rather than getting in the weeds, and maybe I'm not reading it correctly, which is very possible, but I think I do want to really emphasize that we need clarity on some of the things that are being discussed here today, because I feel like I heard differently, or I'm reading differently, or maybe I'm interpreting differently some of that stuff. Jill, what do you got?
Jen and Annette, did you send out the materials to folks ahead of this meeting with the cleaned up version of the bylaws?
Yeah.
Okay, so everyone does have, it's not a secret document anymore. I took all of the attorney
Okay, thank you, Jill.
notes off of it and sent it out. So you should have two, when we're talking about what needs to change in the bylaws, you should have two documents. One is a track changes version that shows what moved and what had to be changed. And then the other is a clean version of that same. So you can see it, like some people's brains is too messy with the track changes, and some people want the detail of knowing exactly what got put in or put out. And that's the document that we're talking about around that the bylaws need to be changed. Like that is one step that we know needs to happen, is that the Alliance is an OHA advisory committee, that the bylaws need to be revised to align with public meeting law and statutory authority, that we've done a first pass at that with Department of Justice, and that either the full Alliance or executive committee or some other group needs to who is interested in wordsmithing in a public meeting format to look at those suggested edits and see and work on the wordsmithing of those bylaws. So just naming that's not a secret document anymore.
Thank you, Jill. Okay, thank you.
And I think that's our hope today, is to try to figure out, because I think, Gally, until we have examples or we really, if the Alliance updates the bylaws, it's hard to get all the answers to all the different nuances. And so if we have access to Shannon to help us do that. And so it's really, instead of Jill and I or others writing the bylaws, we want, this is your group. And so wanting to make sure that we give you the guidance, the technical assistance and access to get those questions answered, but really it is the Alliance that can update those bylaws. And so you all can decide sort of who would love to dive into that.
So I'm seeing Laura Rose's, I hear that, Chelsea. I also think I'm reading people's faces in the room and looking at the chat that I'm having a hard time following, and just the questions that are coming up. So I just, the bylaws are important, but there's lots of questions that people have, which OHA team may or may not be able to answer. Laura Rose, there's a question that you have offered in the chat around, please get clarification on ability to do homework. Do you want to pose that question to the group?
Well, that one, like, I think, unless I'm mistaken, things have moved pretty quick, so my mind's trying to keep up.
Yeah.
Chelsea had said something along those lines. We talked about that homework piece, so I'm just making sure it's in the chat and in the notes so that does get addressed. And I'm saying, yes, please do that. That'll be great.
Yeah.
My other question was, sometimes with something like this, like, we're trying hard to make things work. Sometimes we're not exactly sure what starts, what ends, on certain levels or boundaries. Is there anything within Oregon Health Authority to, like, volunteers who are in public service to in these roles with councils, to the advising of the Oregon Health Authority? Is there somewhere where, like, we would have any kind of representation, or we would have any access to legal counsel if needed, if like a clarification came up or something? Sometimes I worry that the way things might be going is, like, if you say something goes wrong on a council or committee, then, like, you could lose ability to serve the state. Some of this comes from some OEI communications, Office of Equity and Inclusion, when they conduct investigations on certain topics. Other parts are just like when there's sort of, like I mentioned, maybe two different answers to a question that seems to be coming from DOJ, an interpretation or something like that. Like, is there access in any way for some kind of support on behalf of being a person serving at OHA? And lastly, I guess one of the interesting things is that in terms of, there's been on several other councils where there's been debates whether or not, like, stipends are going to end up being considered as a W-2, which then has implications, or as a 1099, like a contractor thing. And so one of my colleagues actually got both a W-2 and a 1099, which is really unusual, which now means, like, do they have a union or something? Like, they're on the state payroll now? I mean, it's really weird. And when we've asked for clarification on that, for example, from DOJ and or OHA leadership, again, we're getting different answers. Even DAS didn't have a clear answer. That's Department of Administrative Services. So there's some pretty big questions out there still floating, just to say, hey, not that we have to answer all that now, but just kind of bringing that to awareness. But the bigger question was, like, so is there a resource that can be accessed from volunteer members?
I guess my first answer is no, there's no legal representation for individuals. My understanding from Shannon O'Fallon is that, she's representing the agency as she's giving us guidance, and thus Gally was talking about sort of attorney-client privileges with OHA. But we would be that we would help with any kind of questions, confusion, and we're trying our best. Again, I think like you're bringing up, Laura Rose, like there's confusion about stipends and other things in many different committees and other state agencies even. And so we're trying to work with DAS and others to sort of figure those out so we could at least get some clear guidelines. But I think it would be more of bringing some confusion questions to Jill or myself, and we can escalate them just as we're doing with this and getting the best answer we can to move forward. Yeah, but I hear you on the stipend thing. It's very confusing.
All right, folks, there are 3 questions that have been posed in the chat. Jen, thank you for helping me track the chat. And then I have a question. So Julie asked, does every decision need to be made by the full alliance? For example, like not having the subcommittees do that.
And I'm going to start sounding like a broken record, but that's up to the alliance. So you're as you do your bylaws and vote on authority, you can give authority to subcommittees to make decisions on behalf of the full alliance. So again, that happens in System of Care Advisory Council where they have votes within their subcommittees on behalf of the full, or
Right.
there's certain decisions that need to come back to the full.
Okay.
And
Thank you,
that's that probably won't be much change. We're talking about bylaws and cleaning up the webbed mess. Like that's the way it is now too, that in the bylaws, some things the executive committee has the ability to make on behalf of the whole alliance. Some things have to go to the full alliance to be voted on. And so you could add in other pieces for the other committees as well.
Gordon.
And one
sorry.
thing, oh, sorry.
Keep going.
One wording piece that's a bit of a shift in how we have, like how we talk versus what the bylaw edits say is that it changes, like the alliance is the committee. The alliance is the YSIP advisory committee. That's the same thing. And so
the statutorily advised, like that's in statute, the alliance is what you're saying. Yeah.
And the alliance was, yes, yeah. And the alliance was an advisory committee before the statute as well.
Right.
And so Shannon wrote in that we should put, so instead of the workforce committee, it's the workforce subcommittee, or like, so that there's subcommittees beneath the alliance, which is the committee. And so just not to get tripped up on that piece of it. And I wonder if I can address while I'm unmuted, Jen's question from the chat, because that's really, really important that that if you notice in the bylaws draft document that I put in the chat and that got emailed out, that it's not that you can't say your name is not the alliance. It's that we have to say in the bylaws, the alliance is serving as like to link them. And so heretofore, I think it says like, the Oregon Alliance to Prevent Suicide is serving as the YSIP advisory committee per, and then list the law, list the statute. They'll be interchangeable from here on out in this document, so that if you're saying the committee with a capital C or you're saying the alliance, that's the same thing.
All right. Gordon's question is next. Gordon, you made the proposal. Does a proposal, I'm going to try and frame this. Does a proposal need to be made public 24 hours before the meeting on anything that is up for a vote? Gordon, I don't know if I'm doing that justice. Will you help me?
Yeah, my understanding of public law, if you've got something that you are going to be voting on, the public needs to see that 24 hours before the meeting so that they can respond to it or whatever. And that brought up the issue that how do I get that to a proposal under the restrictions that I'm feeling DOJ is imposing on the committee. And one real quick side note is, Jill, when I looked at the bylaws that were presented, they referred to June 23rd of 2023 as a copy. And it was very confusing because we didn't have a vote, never did have a vote on the bylaws as I understand it. So the two that were presented are what DOJ is recommending we approve.
No, Gordon, the DOJ is offering guidance to Oregon Health Authority because Oregon Health Authority is DOJ's client. And so now Oregon Health Authority is bringing this guidance to us saying these are the things that we are going to need from you all as an advisory group in order to be in compliance with the statute and public meeting law.
Got it.
Okay, next question is, I lost it.
The
Is,
other.
oh,
the other
sorry, go ahead,
piece,
Gordon, sorry, go
Yeah,
ahead.
was how do we get there? If it's true that the document has to be available for the public to read 24 hours before the vote, how do we get it to the proposal state under the feeling of these restrictions of not being able to meet and not being able to put something together, to present that to the public 24 hours before we vote on it?
And Gordon, I think that is a great question, and that is all I can say right now. I think the bylaws that will need to be done will help figure that out. But I guess I'm trying to keep us from getting too far down into the weeds, because I think if we go down really deep in the weeds, we'll get stuck there. And there are those questions are really important, folks. So I don't want to say they're not, but I think in the next, 15 minutes that we have left, I want to make sure that maybe folks who haven't spoken, who have questions or concerns, have space to do so. And that we make sure that we're going to add that, Gordon, to the parking lot of needs for follow-up though, okay? Because that's a great question and that's not a simple answer. Angela, you are asking, can we clarify the difference in advocating for and lobbying for legislation? And that might be, maybe we put a pin in that too, folks, and that is okay.
Yeah, I think we can do some definitions. I mean, Laura Rose did a great job in the chat, giving some examples. But Laura Rose, like me, is not an attorney. But there's some good examples there.
Okay.
And again, I think it's, having direct communication or direct meetings with the legislators, it's being clear. Again, you're advocating and educating and advising us as the Oregon Health Authority. So I think that's the big difference. It's like a small difference in the language, but a big difference in practice for this group.
Thank you. And I have one question, Sean, I see your hand. So my question is, my understanding is that because this group would be required to meet public meeting law, and that many of us are volunteers that are part of the expectation of adhering to public meeting law, that communication about this work is subject to public meeting law, which means emails are subject to public disclosure if requested. Is that correct?
That's my understanding.
Okay, so I think that's also an important piece to bring into this conversation, just to be fully transparent, folks, right?
Mm-hmm.
Is that as
Yeah,
well?
it should all be public. Yeah.
Yeah. Ishan, go for it.
I just want to honor, I know I'm new to this alliance, and it sounds like this is a big shift to how things have been, how this collaboration has been able to go. So I can see that this is shocking, and there's some strong feelings around it. So my ask is, I know we got 15 minutes left of kind of what are our next steps? Because it sounds like there's a lot of changes happening, but there's some things that we as an alliance and a committee are kind of going to be tasked with needing to do. And so I'm just kind of trying to wrap my head, it's a lot of information, trying to wrap my head and kind of see where do we go from here? What is the ask of the group?
My understanding, help me if this is, Chelsea and Jill, what you're hoping for. My understanding is that what our OHA partners would like is for us to work on bylaws and to come up with bylaws that are piggybacking on the bylaws that were sent out, and that we get to define what our bylaws are as long as they are within the scope of our statutory authority, which is the problem that we've had, right? Is that we've been operating out of our scope, not knowingly, right? Nobody knew, right? And none of us knew. OHA, us, none of us knew. And now, and Sean, I want to take what you said and just kind of piggyback on that this is a huge shift, folks. And all of the questions and the comments in the chat out loud, all of these things, of course we have questions because this is a huge shift in how we've done our work. And our work is going to look very different. Excuse me, how we do our work is going to look very different because it's going to be under different parameters. So my understanding is that the next step would be to come up with some bylaws. And then my understanding is that we, as an alliance, would vote on moving those bylaws forward to you for your review, OHA. Is that how it would work? And then you would approve them or not approve them, is that right?
I mean, our hope is that we just do it in coordination so that once you're bringing
Together.
the bylaws here to the full
Okay.
committee to vote, that would already have happened.
Okay.
Yeah.
All right, Justin and then Jill.
Chelsea, that kind of made me laugh because then I'm like, we're coordinating and it has to be under the the meeting law requirements in order to make that decision. So I just wanted to, I guess, a frame of reference for me in special ed land where we live with law and attorney practices is that the attorneys are always going to recommend stuff that is very narrowly constructed, right? And very sort of letter of the statute. I think it's within our realm to have things that, our job is to not paint ourselves into a corner where essentially the alliance is unable to get any work done because it's wrapped itself in circles. So obviously OHA, it will be up to OHA, it sounds like, to make the final determination as to the acceptability of any other rules. But I think for this group, in terms of bringing suggestions forward, that we really just keep an eye out for the way that the work can get done within the structure that is required of many other organizations. And they can get that work done, but it definitely makes it a little more cumbersome. Maybe that'll improve some practices in some areas. That would be my hope, but I would urge us to look at it from a framework of not just taking lawyer recommendations and that structure on face value, because I don't think it serves, and it is a bad look out there publicly to say, oh, guess what? DOJ basically said all suicide prevention work for students, kids in the state, it has come to a screeching halt because because of these requirements. I think that's a bad look, and I don't think that serves anybody's interests. So just my 2 cents on it.
Thanks, Justin. Jill, go for it.
Justin Potts, you were in my head that you've been saying that piece of wisdom for a really long time, like we cannot build a process that has no way to move forward, and therefore the work of the alliance screeches to a halt. That cannot happen. So I just wanted to name that that as a proposal knowing that we cannot vote today because we don't have quorum anyway, which is one of the things that we have to get into line with right now. So two things. One is that Shannon from DOJ said it makes sense to have like a 60-day, aside from public meeting law, which is quorum, having a 60-day kind of grace period to get bylaws in line, to have all of those untangle some of the web, so that we don't get stuck in a loop of like, well, we can't do that because we haven't done that and we haven't done this, and so to actually be able to move forward. So that's one, is that and number two is that the full committee can vote and give permission for another smaller group, so that this whole I think there are 57 voting members of the Alliance, so that we don't have to try to get quorum of 57 people to work on bylaws and move some things forward, that the full committee can vote and approve and give permission and authority to another group to work on bylaws. That can include the executive committee. It can include affiliates that as long as they're named and voted on by the full committee. And the purpose of that is so that it's public, so that it's a clear and transparent process of who is working on in work sessions, who is working on the bylaws to bring back to the full committee. So a path forward could look like, one, we schedule another full Alliance meeting in July, that OHA and the Alliance staff clean up the membership list to remove members that are no longer interested in being a part of the committee, so that we can get to quorum to be able to vote to approve that other group to work on bylaws. And that gives us enough time for OHA to get some answers to these questions that we've been gathering as well. And so in theory, in the meeting in July, we could gather with a list of members that is quorumable, that's a word, with some asking for some more clarity on answers, and then give permission. You all could give a permission to a subgroup to work on bylaws, so that it doesn't have to happen like this. It still would be in a public meeting with noticed meetings, and people could show up to them and listen in, because that's the intent of public meeting laws. Anyway, so that's my proposal for like tangibly from here, how do we move one step forward?
Jill, can I just, my apologies, folks, I was responding to a chat. You mentioned the 60-day window again. Will you just say that again? Because I was not attending to your comment.
Yeah. And 60, so Chelsea asked for until the end of August. So August 30th, that we have until August 30th. We have to abide by public meeting laws until then, which means that if groups meet like this, we have been doing a lot of public meeting stuff already. Like the thing that's different is quorum. Yeah. And so this group, we've met and we've gathered within public meeting law, within the umbrella of the statute. We can't vote because we don't have quorum. And so that the public meeting law has to happen now. Like we have to abide by that for quorum and noticing. But we've asked to give a grace period until the end of August to get the bylaws in line and redo and untangle. Yeah.
My apologies for not listening. Okay. I guess one of my questions too, even like around cleaning up membership, is my understanding in previous conversations is that the OHA director had to accept the resignations of individuals who were no longer wanting to be a part of the Alliance and appoint members. So given how busy everyone is, are we going to be able to have like a refreshed version of membership by July, which has the OHA director accepting resignations and appointing people? That seems very optimistic, with all due respect to our OHA colleagues.
Yeah. Chelsea, do you want to talk about the level of commitment we have to that?
Yeah, no, I mean, it's an internal administrative process for us, Gally, and all
Okay.
this is, I think, as I've told you, like, I mean, we have everybody realizes this is a mess that we're collaboratively cleaning up. So I don't want to speak on behalf of Sejal,
Okay.
but
But
I
we
mean, I
have
think
commit,
we put
you
this
have
in
commitment.
front of her with the context of like, we're working with this group to do this work. She's aware of this work. So I think it's an administrative process that we could accomplish. Yep.
I guess the other thing that I would argue is, that I'm confused about is like, we are going to be essentially, my understanding is that OHA is going to be sending out letters to folks, existing letters to folks who have already been appointed, kind of clarifying the role of what it means to be part of a statutorily, like, with it, what our scope is, essentially, just to kind of give us clear expectations as members. And I think it's hard for people to accept membership into something that they don't completely yet understand. There's questions about stipend. There's questions about how, so I think I like this idea of meeting in July, but people can't make a decision or develop bylaws on something that they don't fully understand what the implications are going to be and what the impact is going to be personally, professionally, on the state level work.
Yeah, I think that's where we went to the bylaws. And again, I warned you ahead of time, I'll sound like a broken record. It's
No,
like,
I know.
so if you're joining a group with no clear bylaws in line with statute and public meeting law, that I would add that to the list. And so if there are those clarifications we need to make, I think it's important to put that in writing as well. And so
Okay.
I don't know that, I mean, I'm not going to commit to fully cleaning up the stipend issue. I think we've done a good job with the process we have and we're paying people, but some of that, as Laura Rose stated, is much bigger than me or just this group. But yeah, I agree with you. But I also think that we can't do all of those things and then not be doing the bylaws as well. So I'm with you. I mean, I think collaboratively, Jill's already working on a draft of the letter. Like, I think work is getting done for all of those pieces, but I think in order to, get in line with statute and law, this still feels, and again, we can have more than one next step. I feel really strongly that this is the next one that we need to do with you.
Okay. Charlotte, I see your hand, and I'm going to propose one thing just about logistically today. It is 10:57. We're engaged in this deep conversation. I don't know, OHA partners, if you can stay around till 11:15. We can just, and we can work on, okay. So folks who need to hop off at 11, please do so. We want to be mindful and respectful of your time, and we thank you for being here. Absolutely. If you can stay on for another, 18 minutes, we would love for you to do that, and we will close at 11:15. Charlotte, go ahead.
My question was just in line with yours, Gally. I know that even as chair and co-chair, some of those questions have come up for us in our process and actually has been referenced back and to our letters in those roles, and those letters don't define any of the things that we had been told that we could or couldn't do, or what that vision looked like. And so I agree with you. I think from my perspective anyways, like, sitting in this role along your side, it would be really helpful to have that information and know what that looks like ahead of time.
I can prep that quickly, actually. And so that could go out as follow-up to this meeting within a week, I would guess. To your point, Charlotte, everyone's letters have bad information in them. Like, that's one of the like, this is messy. And we've not been doing it. We did it the best way we knew how, and it hasn't been.
Fully understand that. I agree, Jill. I think everyone is doing the best that they know how to do. And I think I just wanted to bring voice to kind of feeling like being there for a whole group and trying to be as supportive as possible. It's really helpful for me to know personally what that looks like. And yeah, so thank you for your willingness to get that ready and going. So
Okay, folks. So Jill has proposed a meeting date in July of the full alliance. So this would be in addition to our quarterly, which would be, Sean, I see your face. It's okay. I got you. It's a lot of enthusiastic thumbs up going on in Sean's virtual box there. This would be in addition to what is already set in your schedule as the quarterly in September. Sean, go ahead. You ask your question while I formulate the rest of my thoughts.
Okay, great. Sorry about that.
No, thank you. You're giving me a beat, so go for it.
I just was gonna respond to the letters being in paper. And is it possible to be both? Because I am gonna be off for the summer, but I am gonna be trying to make these meetings. And so I won't be in my office. Okay, thanks.
I think the other, Sean, what you're saying was another thing that I wanted to bring in. Someone wrote, I think Mary wrote in the chat, that a lot of people are going to be not available in the middle of summer, given holidays, vacations, being off of work, etc. And so if we are going to, again, I don't know what the right answer is, folks, but if we are going to meet in July, try and get quorum to give power to another group, a splintered off group to develop bylaws, I'm concerned that we wouldn't have quorum. We don't have quorum today, and we asked for as many people to come to this meeting as possible, and it is not yet the end of the school year and it's not yet summer. So I don't know what the solution to that is. I mean, I guess we could hold a meeting in July, or we could wait until we have more people potentially available, but that would also slow down the process of developing bylaws, which we need to develop to be able to move forward. It would also add additional time, though, for OHA to get clarification about a lot of the questions that we've posed today. So, Monica.
Yeah, actually, Julie just shared the same question in the chat, which is, can there be a virtual or electronic quorum, which I know I've done with my union at PSU before, and just curious if that would be a solution, especially for a lot of folks who will be out of town or off work.
That is a great question.
I don't know what that means. Can you clarify what that means, Monica?
Yeah, so for our union at PSU, we had to vote on a number of items, and they actually did a virtual vote via
What does that mean?
Google
That part?
form. It was a Google form, and essentially they had to have a quorum of people return their vote, and we each had a unique ballot that was associated with our name and identity, so that people weren't sort of falsifying the vote, and that was a pretty straightforward process.
Yeah, great question. My understanding is that it has to be in a public meeting, so it cannot be electronic. So no voting via email or any kind of electronic process. That's why I wanted to clarify what you meant by virtual, but it has to happen in a public meeting.
Laura Rose, I see your hand, but I think also I just want to bring into the room and call out that here is an example of why this is so hard, frustrating, complex, is that even trying to get a group of people together to vote on the future of our alliance is complicated, and because we have to adhere to these certain things. Laura Rose.
Two things real quick. One, I was trying to understand if she was saying forum, F-O-R-U-M, or F-O-R-M, but I think she was saying form, F-O-R-M. Sometimes, like when there's board meetings and whatnot, people can vote, but electronically, but it has to be unanimous. But it sounds like for public meeting law, it has to also include those aspects for discussion and some other steps. So that could be different. Lastly, I sort of had a comment along the lines of public comment, if you will. Like, I know this bylaws stuff is super important, but I'm also wanting to share and bring up one more thing if possible. So if
Please, go
there's a
ahead,
time
Laura.
on the agenda
No, go
for
ahead.
public meeting, I mean, public comment. So sorry. I want to make sure people are ready to switch gears. So I'm happy to wait till everybody's had a chance to have closure on this first.
I don't know if there's going to be closure on this for a little while, so I think it's fair to say that we can move on to your question, Laura Rose, knowing that we'll come back to this.
Thank you. Well, something that's near and dear to me that happened this last quarter, not necessarily directly connected with the Alliance, but in our broader community of people with lived experience serving in advisory capacity or that sort of thing. There was a tragic loss of life, death by suicide among some of our community. And unfortunately, it's not just the one individual, but there's other people with lived experience on some different advisory councils, not just only OHA, but like we have community advisory councils, we have other advisory councils. And oftentimes people, will come to me or others for support. And so with some of the bureaucratic work and other kinds of things going on, I'm trying to keep it in a general sense, but also there's some specifics. There's people experiencing suicidality, which is the full range from, say, suicidal thoughts to intensive thoughts to impulses to plans. And so I would like to ask that as things move forward, that we hold a space for the trauma aware, informed, sensitive, and responsive lens. Some of this work is passionate, some of it's emotional, some of it, we're bringing in, people from many diverse backgrounds, many different abilities, sometimes, and sometimes those get in the way. Sometimes people don't realize there can be invisible disabilities, things like that. And so just having that trauma-informed lens when we, creating bylaws, for example, but, just across our councils across the state, I would really ask us to hold space for that, especially for our people with lived experience. We also never know what somebody is going through at the time or how something might hit them. And I think it would also be proactive, responsive to make sure there's sort of maybe a process in place, maybe something we can add to orientation materials. It goes beyond just telling people to call 988. A lot of people aren't comfortable calling 988 for different reasons. I think, some basic strategies would be really helpful to go a really long way. And so I just thank you for the time and the share and the hearts I see. And yeah, that's what we're here for. And so I'd love for us to be the leaders on that page. And I'll do whatever I can to help. Thank you.
Thank you, Laura Rose. And I'm so sorry for the loss of this human who you have mentioned in your community and many people's community. So, and folks, I think I'm seeing the chat and I'm seeing that the idea of having a meeting in the summer would be really great for logistically to be able to move this work forward. But based on what Laura Rose just said around really doing this in a trauma-informed, equitable way, I don't feel like meeting in July is the right thing to do. If a lot of folks are already like off, we know that a lot of folks are off for summer. And so I guess I don't know why we would schedule a meeting knowing that a good deal of our affiliates and members are not able to attend. I don't know what the solution is. Because I recognize the longer we don't do the bylaws, the longer this process will take. And I also feel like this group has done a really great job of taking care of one another and being in hard spaces together and working through the muck. And this is the muck. And so I don't want to rush it. Kelly, I see your hand. Go ahead.
In listening to everyone's comments, I'm really struck by how thoughtfully everyone is approaching this. And I wanted to suggest that perhaps some of us who are in leadership roles could have a conversation around putting an email together that would explain this to the full membership, maybe following up that letter or following up that email with a letter in the mail that says, hey, we've sent you something, and including the option to vote electronically on how to proceed, whether that means convening in maybe August in order to give time for that all to go out. I think it's important to figure out something as an interim solution, whether that's an ad hoc group that makes some recommendations in the interim, sort of unofficially, like making some ideas and having conversations and tracking those somehow, or putting it to a vote and asking folks for their input on forming a committee, and then maybe having people step up to participate in that committee and having a second vote after that. I think waiting until September means that we are taking a hard break. And what we know is that the summer months are very difficult for people, especially veterans. And I think we would all agree that we don't want to leave any of those communities behind by taking a long pause. That to me, it makes it feel like we're saying that ticking all of the boxes for DOJ is more important than individual lives. And I know that I don't agree with that. So we don't have flexibility in voting electronically. Okay. I thought that we could vote electronically as long as people's names were attached to their votes. So somebody
No.
please correct us if that's correct.
Not
Yeah,
with
vote-
the DOJ
but-
for the meeting laws, we can't.
Yeah, votes have to happen in a public meeting with the humans there. Yeah. Yeah, that was one of the shifts in one of the other councils I was a part of. There was some voting that was happening outside of or in via email, and that it has to be in a meeting.
Do our
And-
current bylaws allow the executive committee to act in an emergency capacity when issues like this arise? It's been a while since I read them, so I don't recall off the top of my head.
Yes,
Yeah.
Kelly. Yes, Kelly. We do have that capacity.
So that
And-
would be my next recommendation then, is to figure out something through that and to have people step up to say that they're willing to do this work in the short term.
And
Sean,
just,
you unmuted. Go ahead.
yeah, just to clarify, Chelsea, we have, you have until August 30th to have, is that the deadline to have the bylaws
Well, here's
up to
here's how-
date?
Yeah, good question. I mean, here it is. DOJ is not telling us what to do. They're advising us as their client. So I'm doing the best to just, I'm trying to find the balance. What I had asked for was, this group has been operating as is for many, many years, and no one's been harmed, no one's been sued. And so what I was asking for was some time to sort of operate as is. Again, we have the law, we have to follow the law, but asking for sort of business as usual so we could get this done. And so that was the timeline I felt comfortable with, knowing that we've been out of compliance with the law and the statute for some time, if that makes sense. So, and again, we've done a lot of the edits in the copies that you have. You also could, get a group together to say, this is good for now, and just keep working on the bylaws. There's nothing that stops you from sort of getting into compliance and then reopening them and doing all of the, I think, as Gally says, the complexities and the nuances of the questions that we gathered today. So it could be that we get everybody in line with the law, and then that's another suggestion, is to sort of do a good enough for compliance perspective, and then keep working on the bylaws ongoing.
Jen, go ahead.
I was just gonna say Kelly's comment about the executive, I think goes back to another question I saw a million miles up in the chat, and I'm so sorry that I can't remember who asked it. And this may have already been answered, but just whether or not if only the full alliance can make decisions on things, or like if the executive could do that too. I feel like kind of Kelly's comment about the executive with the voting for that goes back to that point too. So I just wanted to point that out.
I think like right now, Chelsea, are we able to operate right now in this moment? Like we have an executive meeting, folks, scheduled for July 1st. That is on the calendar, on your calendars for executive team. That is on your books. Are we able to operate with our existing bylaws as we know them right now as part of that grace period?
That's why I asked for the grace period, right?
Okay.
It's like, I mean, again, making it all public, like staying in public
Okay.
meeting law and making sure everyone knows what you're doing and all the things. And if you make a decision, it's clear and things like that.
Okay,
Yeah.
Here's what I'm going to propose. I'm going to propose that everyone who is able to attend the executive committee meeting, which is a public meeting, folks, July 1st from 2:30 to 4 p.m. I recognize that is in a few weeks. I recognize that is summer and some of the complexities that we've talked about exist. Mark your calendars right now, folks. We can get calendar invites to folks, but July 1st, Lois, July 1st, 2:30 to 4, put it in your calendars as a hold. We will get you the invite. I'm proposing that at that meeting, we come up with some very clear, actionable next steps. Chelsea, I wonder if I could ask as chair for more grace period, if we could ask for until the end of September. And that would allow us a little bit more wiggle room to deal with all of these complexities. You can certainly say no, but again, like you've said, we've acted in this capacity for years. And I'm wondering if just yet another 30 days, so giving us 90 days to kind of work on this would be something that you all would be willing to do, and you don't have to answer right now. I don't want to.
Yeah, I mean, my first thoughts, and I can loop back with leadership, but I think my first thoughts is as long as we're clear around the lobbying piece and the public meeting law, if that makes sense.
Kelly, I heard your statement as a proposal, and if that's true, I second.
Well, I'm not calling for a vote. You know, the meeting is on the calendar, and so we don't need to vote about that. So anybody's, you know, unless there's something specific you want to vote on, Gordon, but I'm just mindful of time. That 11:17, I told you all we'd keep you to 11:15, but yet you all are here. So I appreciate that no one has, people are still here.
Well, there are a lot of things under our current bylaws, like accepting the chairs and accepting the chairs of the different committees and accepting bylaw changes that were supposed to happen this meeting and the next meeting.
Right.
And since we are still working under our former bylaws, might be a opportunity to consider some of that.
Yeah, right. You're right, Gordon. I mean, many of you have been waiting to be voted in for almost a year now. And I recognize that as that's awful. So I apologize, because this is all just really kind of a hot mess, folks. I'm just going to say it's kind of a hot mess. So July 1st, 2:30 to 4 p.m. Come one, come all. We will get you the meeting invite. Mary's asking, will we have clarification from OHA by then? I think my guess is that we will have as much clarification as OHA can give us at that time, knowing that I know that the OHA team is working very hard, not just the OHA team that we see here, but I know there's a whole bunch of people working on this as fast as they possibly can.
I think also if we can get, in the meantime, some of those examples we talked about earlier, I think a request of sort of 4 or 5 examples of work out of committee would be really helpful, given some of the other questions that are being asked.
Julie, what is the purpose of the executive committee meeting for voting members not part of it? Well, there are voting members part of the executive committee. Julie, you're muted. You're muted.
I'm sorry. Hey, thanks, sorry. I meant, for those of us who are not part of the executive committee, you want us to be there if we're voting members, and what is it that we can do? We can authorize the authority of this bylaws committee, and if we get a quorum, I'm confused. And is a quorum of the executive committee enough to say, yep,
Yes.
we can get you, we can get
Yeah.
this bylaws done.
Great question, Julie. Thank you for keeping us focused. So my hope, my vision is we get as many voting members as part of the executive team there on July 1st, folks. So please, please, please attend. That group hopefully can give authority to a subgroup to work on the bylaws. If we don't have quorum, though, we will not be able to have that authority.
Great. So you are looking for
Members,
designated members of the executive committee.
the folks who have an appointed, have been appointed by the director of the Oregon Health Authority.
The executive too has specific roles that are represented on there, so I can include their names out to, if I can do it fast enough, I'll put it in the chat right now to say who the voting members are in the executive. But if not, it'll go out in a list to everybody afterwards, just so that way you can see. But there's a set, like, not right number, like 10 people who are appointed specifically to vote on the executive.
Lots of good questions in the chat, folks, about like, if you are not an appointed member, if you did not get a letter, if you're waiting on a letter because we haven't voted you in, or you don't have a letter because you are an affiliate, your voice is incredibly, incredibly important, and you will not be able to vote, but you will be able to add input, which we need. So please, please, please attend July 1st from 2:30 to 4 p.m. Annette, were you going to say something?
You just said exactly what I was going to say.
Get out of my head. All right. All right, folks. I just want to take a minute just to bring us kind of back into our brains as much as possible. I recognize that this pulls on my heartstrings in a really big way. And I imagine it pulls on a lot of your heartstrings in a variety of ways, whether that's feeling a lot of feels or anger, frustration, excitement, confusion, what the heck's happening, all the things. I want to recognize that we are in a huge transition. 3 months ago, when we had our last quarterly meeting, we were acting one way, and now we have to pivot in a significant way and act differently. And that feels a little bit, I've been saying to people, and I've heard other people say, it feels a little bit like whiplash. And so I just want to hold space for folks in this room to recognize this is not a trauma-informed process. This process has created a great deal of harm. The intent was not to cause harm to anyone. And, you know, we know that. We know that, you know, OHA saying, hey, folks, you're out of compliance was not, the intent wasn't to cause harm. But we recognize, and I know Jill and Chelsea and Shanda recognize that harm has been caused. So I wanted to acknowledge that, recognize that you all are still here, despite me saying we're going to end at 11:15. So thank you for being committed to this work. This is going to be a really muddy process where we're going to probably have more conversations like this. But I think what we did today, slowing down, pivoting, we had Taylor. I want to just call out, Taylor was prepared to present some really great data, which is very important, but this conversation is more important. So thank you, Taylor, for being able to pivot. We know that if we don't take care of you all to do this work, you're not going to stick around to do it. So, thank you for being here. Thank you for being honest and transparent and real, and not being afraid to ask the hard questions. OHA, thank you also for being real and candid and taking accountability for where we are. I hope I get to see every single one of you on July 1st. Please come with your thinking hats on. And until then, please take good care of yourself. Have a wonderful weekend, and a good start to your summer for those of you who are about ready to be out or out of school, and take good care. We will see you on July 1st. And if we don't see you on July 1st, we will see you at our quarterly meeting, which is September 27th in Bend. There is a hybrid option to either be in person or be virtual. Take good care, folks.
Thank you, Callie.